Just a week after Omicron was first detected in South Africa, the US has now identified its first case of the variant in California.
The individual was a traveler who returned from South Africa on November the 22nd and tested positive on November the 29th. The individual is self-quarantining, and all close contacts have been contacted, and all close contacts thus far have tested negative. The individual was fully vaccinated and experienced mild symptoms, which are improving at this point.
Public health officials expected the new variant to quickly find its way to the United States. This despite a ban on travelers from 8 African countries, including South Africa. Washington is now looking to introduce tougher restrictions, including stricter testing for international visitors. South Korea is also relying on stricter border controls. This after 5 Omicron cases were identified there. All arrivals will now have to quarantine for at least 10 days. The move comes as South Korea saw record infections Thursday. It registered more than 5,200 new cases. The WHO have warned against border restrictions. The organization has renewed calls for vaccinations. They say jabs are more effective in fighting the spread.
Globally, we have a toxic mix of low vaccine coverage and very low testing, a recipe for breeding and amplifying variants.
In South Africa, where the first Omicron case was detected, 35% of the population are fully vaccinated. The variant is quickly becoming dominant in the country. COVID cases there are growing exponentially. Infections rose to more than 8,500 Wednesday. Last week, the daily tally was just 1,275. But experts say it's too early to be sure that the Omicron variant is driving the surge.